People watching, Conan Gray. Hi, everybody. This is Traxx Midday Buzz, and it's 11:15 a.m. We have a very special guest, and we will be talking about tuberculosis. And just so you know, this is a segment of What Matters Health, and our guest for today is Dr. Nurul Firdaus, and she is a medical officer from the Department of Public Health. Doctor, thank you so much for being with us today.
Thank you for having me.
How was traffic?
It was good, surprisingly.
It was good. All right. No, because during the holidays, normally the traffic would be horrible if you balik kampung and south the Pas Highway. But in the city, it's so nice and breezy.
It's a holiday for us.
Yes. So, doctor, what'd you have for breakfast? Just curious.
I had some scrambled eggs. How about you?
Oh, that's healthy. Okay. I had a banana smoothie.
Oh, okay, that's healthy too.
Yes, thank you, doc. Oh, coming from a doctor, I'm flattered.
Approved.
Thank you, doctor. Okay, so today we're going to talk about tuberculosis, and the topic is public health. TB. So, doctor, let's just start very simple, right? So, explain to us, what is TB?
Okay, first of all, thank you very much for having me here. And it's an honor to be able to share this information, especially with the height of tuberculosis cases within these few weeks. So TB or tuberculosis is actually a disease that starts with a bacteria called Mycobacterium tuberculosis.
Right.
So this is usually a bacteria that stays in your lungs, and it can actually travel to other parts of the body, from the brain to the glands to your bones and the gut.
Right.
So it's not just a lung thing.
Ah.
Yes. Right. So TB is airborne, by the way.
Okay.
You can catch it from someone who is infected, who speaks, sings, or even sneezes in front of you.
Okay.
But not to worry, it's not transmitted through touch. So you can shake hands, you can share food.
Okay.
Just don't inhale the air that they are coughing into.
I'm trying to grasp. If you shake hands and if they speak, that would be hard. So if I were to wear a mask, would it be fine?
It would help a little, but even the person with symptoms needs to wear a mask to
Okay.
reduce the risk of transmission.
Okay, so that's how TB spread.
Yes.
And well, lately it's common now. I mean, there's a lot of cases rising.
Yep.
So I'm curious, why? Do you have any,
Okay.
why so sudden, you know? I mean, or is it even sudden? Am I?
That's the key word. It's not sudden, actually.
Huh.
TB is endemic in Malaysia.
Right.
Yeah, we are an intermediate burden country. So TB has been around. It's not something new that just popped up. It's not something that was history, prehistoric areas. Or it is something that has been ongoing in Malaysia.
All right.
And the Ministry of Health and also other healthcare facilities are actually working really hard to curb TB.
Right.
So it is also not particularly brought in by foreign workers or those who are not from Malaysia. It's actually something that's within our shores as well.
Right. Okay. So what are the early symptoms that people should know? Like, okay, if I have this, then what's the next step?
Okay, all right. Very good question. So generally, the common signs of TB are chronic cough and also thick sputum or phlegm. So if your cough is lasting more than 2 weeks, that's already a sign that you should get further treatment or further assistance. We'll get checked out, get investigated, because it might not be a common cold. And since we travel a lot nowadays, we travel in using public transport, and we're in crowded areas a lot. So the common signs and symptoms can include that chronic cough with thick phlegm. You may even cough up blood.
I was about to ask you that. Right.
You may cough up blood.
Okay.
There may be unexplained weight loss. So you're losing weight without trying. And you may also feel very tired, fatigued, get fevers on and off, especially in the evenings.
Okay.
Yep. So these symptoms can actually be signs of symptoms and signs of TB.
TB.
Some people even get like swelling over the neck area.
All right. What if a person has fever for around 2 weeks, but they don't have cough? Would that also be a symptom of TB?
Okay. So generally, inactive TB, a person usually does have cough. But if you have just fever and not cough and the other associated symptoms, it may not be, but better get checked out. There may be other symptoms. There may be other reasons to why you're having fever. It can be a urinary tract infection. It can
There's
be
a lot.
pneumonia. Many instances from head to toe, actually.
Yeah.
But usually the common symptoms are prolonged cough, coughing up sputum, coughing up blood if it's really bad,
Right.
loss of weight, loss of appetite, and night sweats and fever.
Night sweats and fever. So that's one beautiful thing about our body, right? The way they communicate
True.
and telling us something's wrong, but we don't know, obviously.
Yes.
Right? So those are one of the things as well. Okay, so is it true that you can have TB but you don't feel sick? I've heard some people, but I don't know if it's yes.
Yes.
There's so many questions running in my mind. Like how is it possible? Is it lucky? Is it luck?
Okay, I love this question because this is what I do back
Right.
at work at University Malaya Medical Centre, because I focus on communicable diseases.
Right.
So we look for latent TB. So
Okay.
what's latent TB? Okay, let me get down to it.
Yes.
So we have latent TB and active TB. Latent TB is when you have the bacteria in your body,
Right.
but it's dormant. It's like sleeping. It's
Right.
not active. Because your immune system has actually done a good job at walling off or, just calming down the bacteria. So you're
Right.
not in an active state of tuberculosis, but there is the tuberculosis bacteria in your body.
Yeah, you're like a carrier.
Yes, something like that. So it's called latent TB.
Okay.
Yeah. So when does it get activated, or when does this beast awaken? It's when your immune system can no longer contain the bacteria.
Oh.
So this is usually seen in extremes of ages like young children,
Right.
the elderly, those with uncontrolled diabetes, those with poor immune systems. For instance, patients undergoing cancer treatment, patients who are having infections. So basically, when your immune system is low,
Right.
this latent or sleeping TB can actually get activated. So when you have latent TB, there's a 5 to 10% chance that it can activate into active TB.
Right. Oh. Then
Interesting, kan?
yeah, it is interesting because so it's not luck, I'd say. It's your immune system that's working. And so meaning that it's good that if you have a really good immune system.
Yes.
Right.
Yes.
So are there any cases where the person has TB and has a really great immune system and the TB never gets activated?
Yes. There's only like a 5 to 10% chance of it activating into active
Oh, 5 to
TB.
10%
Yep.
chance. All right.
If your immune system is on point.
Okay, wait. Now I have another question. How do you have an on-point immune system?
Okay, so there are modifiable risk factors, non-modifiable risk factors. So the
Okay.
modifiable ones are how you take care of yourself. Your
Right.
nutrition, your exercise, basically living a healthy lifestyle.
That helps, eh?
Very much. Very
Listen, guys, it helps.
So banana smoothie on point.
Okay, guys. If you one of the ways for you to stay healthy, have a banana smoothie. Even sorry, you had scrambled eggs?
Yes.
Yes. Even that's healthy, right?
Yes,
Protein.
Good protein source.
Right. So one of the keys for you to have a very good immune system is nutrition, healthy lifestyle,
lifestyle.
not just workout, or even your sleeping hours, right?
Yes,
Helps with immune system as well.
Okay, this is something close to my heart.
Yes, please, doctor, spill it out.
Stress management
Oh,
is important. I cannot stress this more. Stress.
please.
So
Okay.
please, manage your stress well, because when you are extremely stressed, when you have chronic stress, burnout, your immune system can become weaker as well. So have you heard of people getting shingles? So that's
mean like-
basically like activating a virus in your body that's dormant, and you have all these painful lesions on your body. So that's usually triggered by low immunity and also stress.
Stress.
So any sort of illness, generally, I would say, if you are having low immunity, you will be susceptible to getting illness. So particularly TB, because it's bacterial mediated. So when your immune system is not working at its best, so that's when the bacteria can actually get activated.
Okay, doctor. I don't know much about how really stress affects the body, but I know we've been talking to my girls, and then they say that because if you're stressed, it disturbs your hormones and somehow it affects the flow of, I don't know, something. There was
Basically,
sorry, a friend of mine, her father, he was very stressful and he had high blood pressure, and that affects his kidneys in the long run.
Yep. Yep.
And it's because of stress. I mean, yeah, because it's really stressful, high blood pressure, and it somehow links, right?
Yeah, it's like a vicious cycle.
Yeah, it's like
That's why it's important to get screened early so that you can tackle whatever it is that's going on
yeah.
appropriately. And it's
Right.
important to actually be compliant to medication, to follow up, so we can actually see how you're progressing.
Yeah. Okay. I think I'm seeing something here. So we can't avoid bacteria that is airborne because you
Yeah.
can't see it.
Yes.
Something that you tak boleh nak nampak. It's not,
Betul.
what do you call that? Tangible, right?
Yes, it's like invisible.
Yeah. So the best thing that you can do is you have to, I don't know if it's right, upgrade your immune system, right?
Yeah,
That's how I
strengthen it.
see
True,
it.
true.
Strengthen it.
Yeah.
Yeah. Instead of, what? Prevention is better than cure?
Cure.
Right, doctor?
Essence of public health, prevention is better than
Yes.
But there's always a way for us to cure as well. Yeah,
Okay.
We try our best
Okay.
to actually manage the conditions.
Okay, all right. Okay, so we're gonna take a break, doctor,
right.
and then I'm gonna play a song, and then after that, I've got some questions to ask.
All right. Very well. Thank you very much.
Twenty-eight minutes past 11 a.m. and in the house we have a very special guest, Doctor. Thank you so much for still staying with us, and to all our listeners, we are still talking about TB. So, okay, Doctor. People are talking about the clusters in Johor and elsewhere, right? So, what exactly is a cluster?
Okay. So think of a cluster like a small fire that starts at one spot.
Oh,
So in public health, a cluster is when you see a group of cases that are linked together
yeah.
by time, place, person. Okay. So this can be seen, for instance, like places in a workplace, in a dormitory, in a school. So when there's one spark,
Yeah.
the fire spreads.
Right.
Yep. So that's a cluster that's related to each other. Sorry. So for instance, there's one case here, and then the next person gets infected, the next person gets infected, the next person gets infected. So it just starts to expand. So that is a cluster. So there have been a few clusters recently. For example, the recent one in Johor where there was a teacher who was positive or had active TB and actually caused a chain reaction. Basically, this required more than 900 people to be screened. But there's no stigma in that. Being screened should not be something stigmatizing.
All right.
Because this is a condition that can be treated.
Yeah.
So wouldn't you rather know than live in denial?
Yeah.
Yeah, so I think what the Ministry of Health is doing is amazing because, with the manpower that we're having right now, we're going down to the ground and actually seeking cases and screening everyone so that we're coming to you to help you find out sooner. Because if you do have TB, you can get treated.
Yes, exactly. Yes. Don't run away. You know, Doctor, you actually pointed out something. Something that I had a conversation. So a lot of people, I don't know if it's right statistically, but you need to go to get what do you call that? Medical checkup at least once a year.
It's a good thing.
It's a good thing, right? At least once a year. But most people, they don't want to because I'm fine, I'm good. I'm scared if, let's just say, I get something. Yeah. So, I mean, the fact that one, because you have to go to get a medical checkup. But this one, the government is going to you. Kementerian Kesihatan, right? They're going to you to screen whether you have TB or not. I think that's a blessing.
Very much.
Yeah.
And
because they care.
Yes.
It's like they're just letting it be.
Heavily subsidized.
Yeah.
By the way, tuberculosis treatment in Malaysia is free of charge for Malaysians. Generally, if you are non-Malaysian as well, somewhat it is covered because we want to ensure that we curb the infectious disease. This is actually a notifiable disease. It has to be notified within 7 days to the state health authorities because the appropriate actions need to be taken immediately. Like contact tracing, we need to make sure people are aware that they are part of this contact tracing, that they need to get tested quickly because if you are positive, we can treat you quickly. And we need to have this herd immunity whereby if you are fit and healthy, young, strong, it's fine. We need to protect the others as well.
Yes.
So we have a social responsibility to the rakyat as well, to your neighbours, to your family. If you are feeling well, does not mean others are as well. Yeah. So, like for instance, if you have latent TB, you are not infectious. You are not infectious.
So it's not what do you call that?
It's not contagious.
It's not contagious.
Yes. So when you have latent TB, the bacteria is sleeping.
Right.
It's not active.
Because your immune system is forcing the bacteria to sleep.
Yes.
Oh.
Therefore, you are also not infectious to others.
Oh.
So not to worry. Just be mindful. If you have latent TB and you suddenly start having a cough, the symptoms of TB, just get checked out because there may be a possibility that it's being activated.
All right. So, Doctor, I have a question because I don't know if I am paranoid, but if I happen to pass by, this is just some imagination that I had. So if I'm in a train and then suddenly somebody next to me coughs really bad and it's a stranger, should I go and check?
Okay.
Because it's just a stranger, right? It's just, I don't know. But it's...
And you don't know the health status of this person, right?
Yeah.
So I understand how this can feel scary.
Yes.
And might even induce panic.
Yes.
Yeah. But we exercise caution judiciously. Like if you are traveling in crowded areas, I mean in this less ventilated or crowded area like the LRT, MRTs, wear a mask. And be a responsible citizen. If you are having symptoms, practice good sneezing and cough etiquette, hand hygiene. So wear a mask. If you really, really need to cough, just cough into the inner corner of your sleeve and wash your hands as soon as you can. Carry sanitizer. So just be clean. That's the best you can do. And also, if you have symptoms, get it checked out quickly, especially those red flag symptoms that I mentioned, the 2-week rule.
Right. Okay. So if you have sorry, doctor, if you have any symptoms, so you can go to any clinic or should there be a specific place?
Okay, you can go to any healthcare facility. Usually the government healthcare facilities are well equipped. I can't say too much about the private healthcare facilities. But yes, please do go to the healthcare facilities to get checked out. Because there are a few tests actually for tuberculosis. One is as simple as just injecting a little bit of tuberculin under the skin.
Right.
And we check the reaction 3 days later. So if it is above a certain measurement, then we subject you to further testing.
I
So this is the
see.
screening procedure.
The screening procedure. So it
Yes.
it won't take one day. It takes how long?
This is if you use the injection method. There's another
Okay.
method where we take blood.
Okay.
It's IGRA testing, interferon gamma release assay. So that one is just a one-time blood draw, and you'll get the results pretty soon, sometimes within a few days or maybe a week or two.
All
So
right.
that will let you know whether you have the TB bacteria in the body.
Meaning that in the meantime, you have to still take care, wear a mask.
Yes.
Okay, this is another question. What if you're staying in a house with your family and apparently one of them has TB and you don't? But how do you deal with that
Okay.
in the same house?
Yep. Good question.
Thank you.
So if you have someone
Yeah.
at home who has TB, most importantly is this person needs to start on treatment.
Okay.
Yep. And the state health authorities will screen the whole family. The household contacts will be screened as well and monitored. But when you start treatment, usually within the first 2 to 4 weeks, that's like the active phase of treatment within the first 2 months. Usually by 2 weeks plus, you are less likely to be infectious. So you can still be in the same house, but wear your mask, stay in a room that's well ventilated,
Okay.
reduce your contact within your active treatment period, those 2-3 weeks, and get checked out by your healthcare worker or your doctor to see if it's safe for you to,
Move around the
yes,
house.
yes. But that does not mean you need to be locked up in
I
your
was about
room.
to ask that, yeah.
Yes, yes.
Oh, but
Wear a mask, practice proper cough and sneezing etiquette. And if you have someone in your house that has very low immunity, take extra caution.
okay, so TB is curable.
Yes, it is a treatable disease.
It is a treatable disease. So how long does it take for it to be treated?
Okay. So it's not as simple as your common cold where you're like, you take 1 week of antibiotics and you're done with
Yeah.
if there's no further complications. For TB, the standard course of treatment in Malaysia is between 6 to 9 months.
What?
Yep. So hold your horses.
Okay.
Not to worry.
Okay.
Because you're dealing with a strong bacteria.
All right.
So if you take the first course of or the first round of treatment, which is the active phase within the first 2 months, this is to actually kill off the major load of bacteria within your body. And then subsequently, basically you get a cocktail of antibiotics. So subsequently within the next maintenance phase, the doses, the number of medication reduces because now you're just looking at killing off the remaining bacteria.
Yeah.
But it's very important not to stop your treatment midway just because you feel better. Remember when you
okay.
go to any clinics, the
Yeah.
doctor always says, finish your course
Yes.
despite you feeling better.
Yeah.
It's because it's designed in such a way that, of course, you feel better because it's doing its job.
Yeah.
But there are bacteria that are smart.
Oh.
They adapt the medication you're taking. So they
Right.
become like superbugs. So if you don't complete the course, you leave a few
Smart bacteria behind.
yes, which can reproduce again. So basically, you need to complete the course because if you do not, there is a high chance that the bacteria may turn into a multi-drug resistant organism
Oh, that sounds
called
horrible.
MDR-TB, which
Okay.
is tougher and more expensive to treat. Usually requires more specialized care.
So it takes 6 to 9 months.
Usually around 6 months, yeah.
Okay. I don't know. I've been to hospitals and there are special wards for people who have TB. At what stage would a person be required to be warded? If they have
okay.
TB.
Yes. So generally, we have you heard of DOTS therapy, directly observed treatment?
When you mentioned it, yeah, I know.
Okay. So this is something that is used in the community setting, especially when the person is stable enough to be treated within the community setting. That means you are a young person, your immune system is fairly okay, you can be treated at home. So you will have a proxy or a person in charge of watching you take the medication every day. So there's this logbook that
Right.
this person has to sign
Okay.
saying that yes, they did see you take the medication. So usually it's at a clinic, a nearby health clinic, or an appointed family member or appointed neighbor, somebody we can trust. So this is not that we don't trust patients, no trust issues here.
Okay.
It's just that we want to make sure everyone who needs the treatment gets it on a daily basis the right
Oh.
way. So it's more like a partnership.
Okay.
Yeah, you've got an accountability partner that
Yeah.
helps you as well, because sometimes you may forget.
Yes, exactly.
So having a partner who reminds you
Yeah.
is very much helpful. And when you come for your follow-up treatment, your healthcare professionals will actually go through this log to see, okay, any missed doses, any issues, any socioeconomic issues that is preventing you from getting your medication. So there's a lot that goes into caring for patients.
Yeah, because it's
Yeah.
it's some people might say it's controlling, but for me it's more like care.
Yes,
You know, it's like
we
every day.
care. We don't want
Yeah.
to control everyone, we just care.
Yeah. Dah makan ke belum ubat? You know,
Yes.
who would
Kalau
care?
belum makan, is there any issue? Are you having side effects that you're not able to tolerate?
Yeah.
Is there something we can do to alleviate these symptoms? So back to your question, who gets admitted?
Yeah.
Those who are frail, those who have low immunity, require extra care. Sometimes people require oxygen support because
Oh,
it
right.
affects your lungs, especially if it's a pulmonary tuberculosis. So you might need extra care within the wards of the hospital. Some even require ICU care. So it really depends on a case-by-case basis.
I
But
see.
generally, a lot of tuberculosis cases are treated within the community, and alhamdulillah, a lot of them are doing well. So our clinic kesihatans, healthcare clinics are doing very well. We even have TB units that go to patients' homes. If you default follow-up, if you don't turn up to the clinic,
They would.
care. It's like, why? Why are you not here? Is there something wrong? Are you
I
not
feel
able
loved.
to come? Yes.
Oh my god, I
So,
feel so
yeah.
loved.
We help.
Oh.
We want to facilitate.
Oh, see? Oh my god, I
So
feel
hopefully moving forward, we can go into telemedicine or VDOTs, visual or video assisted dots. So you don't have to have like a physical person there, but yet your care is still taken care of.
I'm seeing this from another perspective already. Okay, so I've heard about this end TB strategy.
Very good question.
Yeah. So what is it?
Okay, so this is something coined by the World Health Organization, so the WHO. So the NTB strategy is actually looking at 90% reduction in cases,
Okay.
and a 95% reduction in cases, in deaths by 2035. So that's about 9 years to go.
Okay.
Yeah, but Malaysia is also adopting the NTB program by 2030. So we are working hard towards it. We have a few more years to go. Understandably, the whole world was set back a little with COVID. But
yes.
everyone's working double, triple, quadruple time to catch up with actually achieving this target. And hopefully we do. Fingers crossed.
Yes, fingers crossed. We want to really end
And
TB.
just like we ended polio.
Ah, okay. I get
So
that.
it's like a collective effort. The Rakyat has a responsibility to play as well.
Yes. So you can't really point fingers at one party.
Yes.
It has to be a teamwork
Yes. Yes.
because I mean, obviously nobody wants to be affected by TB.
True.
So we all play a role in this, right, doctor?
Yes.
Oh, that's lovely.
Any infectious disease, actually.
Yeah.
Yep. We all play a role in it.
Yeah, exactly. And knowing that now there's so many klinik kesihatan nearby, a lot of healthcare facilities, as you
Yes.
mentioned, right? And even if you can't travel, they can actually come to you as
Yeah.
well. Yeah.
But these are for select
Yeah, for selected
cases.
ones.
Yeah, for those who are able to, please do go, because our resources should be directed equitably. Yeah.
Okay, doctor. So we are coming close to the end. I know. So any final say to all our listeners here at TRAXXfm?
First of all, thank you very much for giving me the opportunity to share about this very important issue. So the Rakyat has a social responsibility, like we mentioned just now, to play our part in actually curbing any infectious disease in Malaysia. And as we prepare for the upcoming festivities, Chinese New Year and Ramadan,
Yes.
yes, please celebrate responsibly. Wear a mask if you have symptoms. Get checked out quickly. And try to have gatherings in well-ventilated areas.
Okay.
Yeah. And if you do see anyone having symptoms, by all means, just give a nudge or advice.
Nicely,
diplomatically.
Diplomatically,
Because
yeah.
we're not judging,
Yeah,
we're not punishing. We want to support and encourage. So to all Malaysians, Happy Chinese New Year and also Ramadan Kareem. Thank you very much.
Thank you so much, Dr. Nurul, for staying with us. And we hope to be able to have you again on TRAXXfm.
Sure thing.
All right. Bye, Doctor. Thank you.
Thank you very much.